This episode is brought to you by TaxAct. Don't do your taxes alone. Join TaxAct's National Admin Night. Admin nights are social gatherings for getting through your to-do list. So get ready for a night of fun, finding deductions, and filing taxes with TaxAct, where you can file your federal and state return for just $49 through April 8. Let's get together and get them over with. Visit taxact.com/admin-night for details.
Welcome to The Secret Life of Cookies, where we try to solve the world's problems through the miracle of carbohydrates, one recipe at a time, with host Marissa Rothkopf and her dog, Bosco.
Thank you for joining me today on The Secret Life of Cookies. First, an apology for the hiatus, but Bosco and I are back now, baking and cooking, and here to discuss the news of the day. There appears to be a lot of news of the day, actually, these days. But today's guest is Wendell Potter, and he has a lot to say about the state of healthcare and health insurance in this country as a former executive at Cigna. I'm so grateful for the insights Wendell brings to the topic, and he shares two very important things all of us need to know to make health insurance actually work for us. I know, surprising, but it's true, and I'm so appreciative to have had Wendell on this week. And on with the show. Hello, and welcome to The Secret Life of Cookies. My guest today is Wendell Potter, who is a former Cigna health executive and author of a book called Deadly Spin, and part of a new documentary that's just come out that sort of shook me to my core a little bit about American hospitals healing a broken system. So I thank you very much for coming today. Thank you. Thank you. And typically, no one can see this at home because it is a podcast, but I do have 3 oranges and I am not going to juggle today. And you have chosen not to share your secret family recipes of biscuits, being from Tennessee. I think you said you maybe are a little shy about that, but I think you're keeping secrets from us. Is this true?
Well, it is true. I was trying to figure out whether to make biscuits or cornbread. I even import my flour and cornmeal from Tennessee. It's got to be White Lily flour from Knoxville, Martha White from Nashville for my cornbread. So I've got to do it like Mom did.
Yes, and a lot of people say like White Lily is really the gold standard of like low protein flours that help make a really delicate biscuit.
It does. There's not a whit of nutrition there, but it makes some good biscuits. I'll tell you that. And Martha White has Self-Rising Plus, I'll have you know, whatever that is.
Self-Rising Plus for added absorbency. I don't know what that means, but that sounds great, and I'm going to look into it because
it's got to be good.
A good biscuit, it's got to be good, right? A delicate biscuit, there's nothing better. So we'll have you on again. I'm sure there's plenty to talk about in the healthcare space.
There is.
And we can work your guts up to do it. I'm making an orange yogurt cake. So one of those very simple sorts of cakes. And I'll be grating oranges, not juggling them or dropping them on the floor as I did before we started recording, and juicing them to get us ready to make this thing. I thank you for being here. We have tried to make this podcast happen for a number of weeks now, and for various medical reasons or other, we have not been able to do it.
Right.
And I just wanted to, as a investigative journalist, I decided to go deep on this subject and send my son to the hospital with a hand and arm infection so that I could really see hospitals from the inside out.
That's dedication.
That's real dedication. My poor son will have a lot to talk about with his therapist. No, of course I didn't send him to the hospital on purpose. However, boy, do I have a lot of insights. The last time I'd spent some time, in a hospital was with my aging parents. And that's a whole different experience of itself. Being in the pediatric ward and seeing how that all works out is its whole other beast. Tell everybody a little bit about your background and what got you, what finds you here talking about American hospitals in general?
Well, I was a journalist in my first career. I was a newspaper reporter in my home state of Tennessee, in Memphis, and in Nashville, ultimately in Washington. But I was kind of pulled away or lured away from journalism into public relations work, first to work for a political candidate, but I was recruited by some health insurance companies, Humana first and then Cigna. So altogether, about 20 years working for big health insurance companies. It was not anything I planned. I just took calls from recruiters and was persuaded by money to go into that kind of work. They make PR people make a lot more money generally than journalists do. So
They sure do,
yeah,
right?
they do. And I did that until I couldn't do it anymore. I saw too much. I think both Humana and Cigna probably regret hiring me because I did leave and became a very vocal critic of the insurance industry. But my first job in healthcare actually was as a PR and advertising guy for a hospital system in Knoxville, Tennessee, where I also lived. And so I got to understand hospitals. This was really some years before we saw hospitals begin to merge and become giants that they are now, which is really a big part of what the movie is about, American hospitals.
So the American Hospitals film features a number of um, former executives and public health officials and physicians all talking about um, how the impact of conglomeration on hospitals and the difference between a hospital. I mean, what it means to be a not for profit hospital. And when I was spending time, when I was in the hospital with my son, by which I mean when I was the mom, because that's all I call you in the hospital. Hey, mom, and which is nice. I like my son. I like being his mom, but it's a funny thing to just be known as mom. Um, when I was there, and I said, I'm going to be interviewing this former Cigna Health executive. What do you have any questions for him? As I was asking all the physicians as they came in, and it sort of stopped a few of the physicians in their track, and they're like, nah, there's nothing to know. Um, Here's what I can tell you, that being a not-for-profit hospital only means in the state of New Jersey, I guess, where I'm from, where I live, that 10% of your population needs to be on Medicaid in order to be considered a not-for-profit hospital. And after that, you get all the benefits of being a not-for-profit hospital, but you only have to keep it at 10%, which creates a number of huge disparities. What have you seen there's been a huge change in how hospitals create profit for themselves since the deregulation of hospitals in the late 80s. What has this change meant for all of us, aside from the obvious that we all feel when we go to a hospital and go, oh my God, that costs so much money?
I think the biggest change is uh, the fact that these big hospital systems that once were, I think, hospitals that adhered to a mission of making sure that people in their communities really received the care that they needed, regardless of their ability to pay. These hospital systems have moved far beyond that. And in particular, the not-for-profit systems. The one I work for in East Tennessee was nonprofit, and I left there just before the hospital industry, if you will, was deregulated, and it no longer exists. It's almost like it's been blown off the map. It was absorbed into another system, and that was absorbed into yet another system, and we've seen that all across the country. Almost every city in the United States has one or two major hospital systems that they've become behemoths because of mergers and acquisitions. They retain their so-called nonprofit status, but that means that they don't pay taxes. And in many states, they really have no obligation to treat many people who don't have the ability to pay. Some of the hospitals that are the biggest and are Catholic hospitals there have been a lot of stories about how they hound patients who have very little money, low income patients. and send them to collections to try to get as much money as they can, kind of blood out of turnips. And these, as this has been happening, these big hospital systems have lost in my view, their mission, their commitment to community benefit, as it's called. And another thing that's happened is that they have forsaken their communities, frankly. They have been chasing wealthy folks. They will move out of rural areas. They'll move out of cities into more prosperous zip codes, more prosperous suburbs. And that means that more and more of us in this country have less and less access to health care and more difficulty paying for it when we do go to the hospital.
That's right. And the Tennessee has lost, I mean, that's one of the statistics that really sort of blew me away in the documentary itself, that like we've lost over 130 rural hospitals, and 13 of those were in your former home state or your home state of Tennessee.
Yeah, that's true. And part of the reason, a big part of the reason, is that Tennessee is sadly one of, I think now just 10 states that have not expanded the Medicaid program as most states did under the Affordable Care Act. It's pretty much under the control of politically conservative groups that have a lot of lawmakers in their pockets that have, despite the fact that 13 hospitals have closed, many rural hospitals have shut down. That has enormous consequences, negative consequences, as we describe in the movie, on the communities. But because of the patient mix that has resulted, in other words, these hospitals have very little commercial insurance patients or patients with commercial insurance, and most of the people have no insurance, and these hospitals just cannot stay in business. And we're seeing that play out across the country. The wealthiest hospitals, again, are those in more prosperous neighborhoods and zip codes, and they're sitting on mountains of cash in many cases. But smaller hospitals are closing all over the country because they don't have that prosperity.
In this documentary, they mentioned the difference between people who can pay versus so how much profit a hospital can make off of someone with employer-paid insurance, say like me, and which I feel very lucky to have, but versus people who pay versus Medicaid, and that it's huge, the difference.
It is. It's huge, and it is a reason why these hospitals have moved away from areas with high populations of people who have Medicaid or even Medicare, because neither of those public programs pay as much as commercial or private insurers. But the other problem there is that private insurers are not able to control healthcare costs, nor are they motivated to do that, because as hospital prices go up, big insurance companies can and do just increase premiums. And that benefits these big insurance companies because they now have more revenue that they can convert to profit. So you have, in a sense, you've had this arms race that has been created by insurance companies, in my view, because I work in the industry and I even handle communications around some big acquisitions that Cigna made. There's been a lot of consolidation on the health insurance business. We now have just about 7 or 8 very, very large health insurance companies that dominate the landscape in every market. And hospitals have, in my view, in self-defense, begun to merge and buy each other to become big, because they felt they needed to have that size, that additional size to be able to negotiate favorable deals with insurance companies. So you've had this deregulation that has affected both the insurance industry and the hospital industry, and the big losers are all of us. The only winners really are the executives and shareholders of these big companies.
USAA knows dynamic duos can save the day, like superheroes and sidekicks or auto and home insurance. With USAA, you can bundle your auto and home and save up to 10%. Tap the banner to learn more and get a quote at USAA.com/bundle. Restrictions apply.
There's no one like you, and there never will be.
From the producer of Bohemian Rhapsody, there are many legends, but there is only one. Michael, rated PG-13, in theaters April 24.
Right. And that was the sort of snappy response I was going to say to you, which was, insurance companies have protected themselves, right, and raised their costs. And then hospitals, in response, have conglomerated and protected themselves and raised their prices or maintained prices to fight that. And little old us, what can we do to protect ourselves? And is there an answer? That what can I do?
Become an advocate, to be honest with you. And I know that what you're doing the Lord's work, just having me on and for us talking about this, in my view. But people need to be more aware. And that's why we did the documentary, to raise the awareness of what's really going on in the U.S. hospitals, why it's happening, why we have to pay so much, and why we have to pay so much out of our own pockets. There are patients that are in the movie from Pennsylvania and Kentucky. One woman from the Pittsburgh area was hospitalized. She had cancer, and she had insurance, but her out-of-pocket requirements were so big that she had to sell her house and move into a small apartment. A young man in Kentucky had a serious condition that he too had health insurance with high out-of-pockets, and he had to file for bankruptcy. This is happening all the time in this country, and people are just not really paying attention. We think we'll go this year without a health problem, next year without a health problem. We don't realize until it hits us what the consequences are. And then it's too late for a lot of people. They lose their homes, they file for bankruptcy. That affects generations of people, not just the individuals that have to file for bankruptcy or lose their homes.
And I'm going to my phone right now because I was so shocked by one of the illustrations that you showed on the during the documentary that we have people who are filing for bankruptcy, right? Average folks. This poor woman, this shot of her, and she's like opening up her bills, and she's like, I didn't want to worry my family because they were worried about my health, right? And so this woman is doing the most unhealthy thing, right? Which is sort of internalizing her own worries, selling the family house, taking on that level of grief and sadness. She was a hardworking American, right? Who had insurance, and here she was having to sell it all so that she could pay these insurance companies. And then I look at these figures about the reserves, the polite term, I think, for the money that these hospitals have, and $668 million they own in U.S. and foreign stock. This is for hospitals in general. I mean, all of them. $417 million in corporate bonds, $699 million in cash. Wouldn't that be nice? $152 million in real estate investment, and $59 million in government securities, and they don't pay taxes, most of them. So, except for their employees, how does that continue? How do we let that happen? How do we become? I'm sorry. How do we let that happen?
We let it happen because we allowed the executives of these companies to have their way with lawmakers, to have what we have with a deregulated hospital system. And that's happened in almost every state. There was one notable exception, which we talk about in the movie, that has done something that has made a big difference in the lives of the people in that state. And that's one of the things that we advocate for other states to look at what Maryland has done that make a lot of sense. But most states just got on the deregulation bandwagon, and now we're paying the big price for that. And the price we're paying is that more and more people who get sick, and we're all going to get sick at one time or another, probably, or injured. And
or have a friend or a family member.
Yeah, right, exactly. Last year, the Kaiser Family Foundation did a survey and did some research that found that 100 million Americans now have medical debt. They're carrying medical debt. The vast majority of those people have health insurance, but they are having to pay such high hospital prices, such high out-of-pocket costs because of the way insurance is now structured, that they're having to file for bankruptcy or lose their homes. One of the statistics in the movie that we show is that of cancer patients in this country, I think it's about 42% of them lose all their savings. Um, so not only are you dealing with a life-threatening illness, um, you also are dealing with bills that come in, even with your insurance. You're paying premiums every month, but you have to pay when you get sick or injured enormous sums of money, thousands in most cases, out of your own pocket every year. It starts over again every year. And that's one of the reasons why I also started an organization or a coalition called Lower Out of Pockets Now, uh, because we need to focus attention on that. There's no reason that we should put up with insurance companies pushing us into bankruptcy as we pay premiums every month, or our employers. So there's a lot that we need to do, and part of it is just becoming, the first part is becoming educated, becoming aware, and then motivated to do something about it, to reach out to your members of Congress and your state legislators, and join community groups to try to figure out how, as individuals and members of groups, we might be able to affect some change.
That's exactly, that was definitely my takeaway from this. There are a lot of issues that we've all felt, that have come up over the past. I think we've become more aware, I guess, over the past number of years about all the issues that we really sort of need to be aware of, right? And I think for one thing that's going to impact every single one of us is healthcare. How do we get our representatives and members of Congress to pay attention to the issue? How do we get more people to know about what's going on in Maryland? So that's two questions, which is not the easiest thing to throw at you. So the first question is, how am I going to get my representatives going? And then I'd love to talk about what's going on in Maryland and why we should all move there if they don't, if New Jersey doesn't shape up.
Because of the careers I've had, I have, in one way or another, been involved in politics, either as an aide to a political candidate, covering both a legislature and Congress, as a reporter, and being a lobbyist. And because of those, I obviously have some familiarity with how things are done at both the state and federal levels. Most people don't, and there is almost some fear and intimidation about reaching out to a member of Congress, or just not thinking it's worth it. It's worth it, and I really think that if there's one thing that I can do through being on your podcast or the other work that I do to get people to understand, it's not going to change unless we get involved. Now, we all are very busy. We all have 99 problems, and we don't want to have another one. But this is something that's so important, and it will affect us at some point in our lives. And if we don't begin to take some action, we're going to pay a very steep price, and many people already are. So number one is get to know your member of Congress and your state legislator. But even more important, make sure they know you. Make sure they know your name. Be a squeaky wheel. I tell people all the time, if they've gotten something denied by an insurance company or a big bill comes in, be a squeaky wheel. Push back. Don't pay that bill. Don't take a denial as a final answer, because if you push back, there's a very, very good chance that what your doctor says you need is going to be ultimately approved, and you're not going to have to pay that big bill. People don't know that. Then healthcare is so intimidating, and certainly when you're sick, you're trying to get well, much less fight big bureaucratic organizations or institutions like hospitals and insurance companies. But you got to get motivated. Check out some groups that are engaged in healthcare reform. I lead an organization called the Center for Health and Democracy, as in addition to the coalition I lead. People need to join those kinds of efforts. So work as an individual and as a part of a group. Regarding Maryland, few people know about that. We felt this documentary needed to, as one big part of this, was to help people understand you don't have to look abroad to find solutions. You can just look to Maryland, which has a system in which all of the payers, whether it's Medicare or Medicaid or private insurance, everybody, or if you are uninsured and have to pay yourself, everybody pays the same amount. That's not true in any other state. It depends on what kind of coverage you have and what kind of insurance company you deal with. They all negotiate separate deals. In Maryland, that's not the case. And in Maryland, another thing they do is have a system of what's referred to as global budgeting. The state has determined how much each hospital needs to keep the doors open and serve the communities that they're in. And it's worked well. Not only are those hospitals still in business, Maryland has had the fewest hospital closures in the country. And there really is no need for a safety net hospital in Maryland because all the hospitals are on a budget, as most families are on a budget, and everybody pays the same thing. Like if you go to a grocery store, you're going to pay the same thing as the next person in line. But if you're talking about healthcare, that ain't the case. So we need to have some sanity in our healthcare system, and Maryland has done some things that make the system much more rational and fair. And what you're seeing there too is that more and more people in those communities, if they have low incomes, are getting the care that they need. They're healthier. These hospitals are really committed to community benefit or population health, which is something that you don't see in many other places.
Also, they have a better outcomes in general.
Yes.
Like the statistics for Maryland show that there's reductions in readmission,
Yep.
reductions in infection rates, all the things that if you're checking out a hospital, you want to make sure they have.
Right.
And it's so remarkable to me. And it's, I don't think enough people know about it. I don't think they know that there's a rate commission in Maryland.
Right. That's true, and a lot of people who've been on the deregulation bandwagon will look at that and say, "Well, that's rate regulation, that's price regulation." Well, we're seeing that it works. It is not those are not four-letter words that some people think that they are, and we are seeing the consequences of deregulation in the hospital business, and what one state has done to resist that and to move to a place where, people are. You're exactly right. These because of the way Maryland pays, what Marylanders pay for healthcare, and the way the rates are set, and the budgets they have, more and more people are getting the care that they need, and these hospitals actually share savings by keeping people healthy. So the incentives are more aligned than they are in other places. In most other places, these hospitals are only interested in getting your dollars and ultimately getting you out of the hospital, but getting as much money as they possibly can without much care for what happens, what your home life is like. And in Maryland, there's more attention paid to what's referred to as the social determinants of health. There are a lot of people who get sick because of the way their lives are, the neighborhoods they're in, their exposure to pollutants, whatever it might be. Most hospitals pay scant attention to things like that.
The thing that I noticed, and I recently had I had COVID, and I were concerned about heart issues. I went to my cardiologist who knew me. One of the things that they did was, I'm fine in case anybody's worried, but one of the things they did was to do a sonogram of my heart, right? And I'd had this before a couple of years back, and the procedure ended up costing me $180, right, after insurance. I just looked at the bill for the charge for this time, and the bill was $2,780. And that, strangely enough, reminded me of another number. And that number was my personal deductible. What's that about?
It's frankly a mistake. It's something that policymakers have allowed to happen because they've been under the influence of health insurance company executives and lobbyists. When the Affordable Care Act was passed, it did make more people eligible and make health insurance more affordable. Um, but one of the things that the members of Congress and the Obama administration did was allow deductibles to increase every year uh, to the point that now there is a maximum, which is a good thing, but a family can be on the hook for $18,200 in out-of-pocket expenses every year, and an individual for $9,100. That goes up every year. People don't have that kind of money in the bank for the most part. Very few people have that kind of money that they can just spend for healthcare. And again, knowing that come January the 1st every year, it resets, and you're facing that obligation all over again. So the people who are most penalized are people with chronic conditions, people who unfortunately get cancer, who have a serious accident and need expensive care. We're penalizing people who need care, and insurance companies are making money hand over fist. And most of the work that I do is trying to expose the profiteering among big health insurance companies. I did a report analysis of the earnings and revenues of the 7 big for-profit insurance companies in this country. Last year, they combined took in $1.25 trillion. They made $69 billion in profits. And you know what they did with much of that money? They bought back shares of their own stock rather than reducing deductibles or out-of-pockets or helping people get the care that they need or reducing premiums. They bought back shares of their own stock. Most people are just not aware of this. And I've said many times, you probably have seen the bumper sticker. If you're not outraged, you're not paying attention. People should be absolutely outraged at what is going on in healthcare in this country, and in particular about insurance companies. By the way, when I say we, I worked with some other folks to do this documentary. It's the fourth in a series of documentaries, and the first one, called Fix It Healthcare, looked largely or primarily at health insurance companies, and they have a long time ago lost their way, in my view. And I saw it up close. That's why I left the industry. I couldn't in good conscience keep working for a big insurance company. I saw too much.
I think that's really why you're doing God's work there, and encouraging us all to do it as well. What are you, I'm sure this is like, when doctors go to cocktail parties and people are like, could you just look at this and tell me if it's okay? But what are your top tips for the people you meet on the bus or at a party or whomever, or just the listeners here of this podcast, about what we can do, one, to protect ourselves, and two, protect ourselves and make sure that we're getting the most from our insurance dollars that we're all spending, if we're lucky enough to have employer-based insurance or our own personal insurance.
Yeah.
What can we do?
Well, for one thing, and I don't mean to be glib or flippant here, but we need to try to avoid getting sick. We need to do what we can.
I was just looking at the oranges going, a lot of vitamin C.
That's right.
Go for it, John.
It's really important to pay attention to your health and try to do things to keep you from getting sick in the first place. Of course, we can't, that doesn't work all the time. We're all going to probably have to go to a hospital. But become an advocate for change. Get involved in groups and organizations that are fighting for change, and there are plenty of them. But here's the thing that I also tell folks. We've got to pay attention to what is happening to our democracy. As I mentioned, one of the organizations I lead is called the Center for Health and Democracy. What we have seen is an erosion of that, and how that affects us when we're talking about healthcare is that the big companies I work for are able to influence public policy that benefits them. They spend huge sums of money on campaign contributions, on lobbyists. My company had an army of lobbyists. The industry has just legions of lobbyists and very few people who advocate for patients. So we've got to change that dynamic, but we have to really address money in politics. One of the worst things I think that ever happened in this country was the Supreme Court's decision on something called Citizens United that just opened the floodgates for big money, dark money that influences elections and public policy. I'm writing something about Tennessee today. It's my heart has just been broken to see what has been going on there in the Tennessee legislature, which I used to cover as a reporter. And at the heart of that is the influence of big special interest that have their way, that are able to control, that have their thumb on lawmakers. That is the ultimate thing that we've got to do. And one of the documentaries that is part of this group of 4 documentaries is called Big Money Agenda. And I would encourage people to look at that and hopefully be motivated to do something about money in politics, which is not only eroding our democracy, but is making us have to pay more and more and more for health care, even if we have insurance.
Okay, well, I thank you so much for coming on. I hope you will come on again as things, as you bring up more of these important issues for us, because I think it's one of the things that we've been really, we worry about it. It's like, and it's not like the weather. We worry about the weather and we can't do anything about it, but we can worry about our health insurance and our own health, and we can do something about it. And that's the message I've taken from you today, and I really appreciate it. Thank you to Wendell Potter for joining me today on the podcast. You can follow Wendell on Twitter at wendellpotter.com. That's Wendell, Wendell, Potter, Potter.com. And please take a moment, if you haven't already, and I'd love you to subscribe to my Substack at marissarothkopf.substack.com for all the hot takes, some cold ones, some refreshing ones, some iced ones, and of course, all the recipes we discuss here on the podcast. Thank you so much, and I look forward to talking to you over the week via Substack and Twitter, and see you next week.
Think Verizon is expensive? Think again. Anyone can bring their AT&T or T-Mobile bill to a Verizon store today, and we'll give you a better deal. So bring us your bill. Walk in, run in, pogo stick in, teleport if you can. Ride on the back of a rollerblading yak or fly in on the wings of a majestic falcon. Any way you can, bring your AT&T or T-Mobile bill to a Verizon store today, and we'll give you a better deal on the best network. Based on Root Metrics Best Overall Mobile Network Performance, U.S. second half 2025. All rights reserved. Must provide very recent postpaid consumer mobile bill in the name of the person redeeming the deal. Additional terms, conditions, and restrictions apply.